Hello everyone. Today's my discussion is on drugs that acts on neuromuscular junction. Now there are several drugs like drugs that prevent the release of acetylcholine, then drugs that stimulate the muscle fibers by acetylcholine like action and block the transmission, and drugs that stimulate the neuromuscular junction by inactivating acetylcholine esterase, and drugs that block the transmission at the neuromuscular junction. So first of all, we discuss about blockage of the neuromuscular transmission. Now the neuromuscular transmission is disrupted at different steps by drugs, chemicals, toxins and trauma. Failure to generate the required end plate potential that leads to paralysis of the skeletal muscles. The paralysis of the respiratory muscle endangers the life of the patient and has to be taken care of immediately. Now the drugs that causes the muscle relaxation that are used during the surgery and in some hyperactive states. The blockage can occur at presynaptic or postsynaptic level. Some of the common neuromuscular blockers which are commonly used in clinical practice and research are presynaptic blockage and postsynaptic blockage. So in presynaptic blockage, botulinum toxin and hemicholinium. Then postsynaptic blockage, curare and galamine. Depolarizing blockers, reversible acetylcholine esterase inhibitor like neostigmine and physostigmine. Then irreversible acetylcholine esterase inhibitor are organophosphorus compounds, pesticides like parathion, malathion and begon, and nowadays used in chemical warfare like diisopropyl furophosphate and serine. Then presynaptic blockage. Interruption of the events taking place at the presynaptic axon terminal leads to impaired calcium influx causing decreased vesicle release. Botulinum toxins and hemicholinium. So first of all about botulinum toxins. The bacterium Clostridium botulinum releases a toxin that causes paralytic disease called botulism. The botulinum toxin is one of the most potent natural toxins, a minute amount of which causes serious illness. The lethal dose for adult human is around 2 to 3 microgram. Botulinum toxin B, D, F and G inactivate synaptobravin, a vesicle membrane protein. Synaptobravin, that is a vesicle membrane protein, and that is required for the binding and fusion of acetylcholine vesicle with the plasma membrane of axon terminal. Then botulinum toxin A and B act on SNAP25 and toxin C breakdown syntaxin. So the botulinum toxin inhibit the release of acetylcholine from the axon terminal, resulting in cessation of muscle contraction, and that leads to flaccid paralysis. Clinical use of botulinum toxin. The paralytic effect of botulinum toxin that is utilized for the therapeutic and cosmetic purpose. Local injection of highly diluted toxin, botox treatment that produce a muscle relaxation at the desired sites. If it is injected into lower esophageal sphincter to treat achalasia cardia, into the extraocular muscles to decrease their overactivity, which is used in the management of strabismus and blepharospasm, into facial muscles to reduce the aging related skin wrinkle, and it is used in cases of cervical dystonia. However, it can also be a lethal bioterrorism agent by dispersing it as an aerosol or by contaminating the food supply. Then hemicholinium. The drug inhibits choline uptake by the presynaptic terminal, resulting in depletion of acetylcholine. Consequently, the end plate potential decreases and axon potential cannot be formed. Then postsynaptic blockage. Variety of the agents that can act on postsynaptic membrane interfering with the generation of the end plate potential by different mechanism. They may be classified into competitive blockers and depolarizing blockers. Competitive blockers are the blockers that block the receptor on the postsynaptic membrane, curare and galamine, that are the examples of the competitive blockers of acetylcholine receptors. These substances diffuses to the end plate membrane and compete with the acetylcholine for the acetylcholine receptor. Their attachment with the acetylcholine receptor does not lead to opening of the ion channel, as they do not have biological activity of acetylcholine. Moreover, they do not get hydrolyzed by acetylcholine esterase. So the acetylcholine binding sites in the receptor remain occupied permanently. In this condition, the motor nerve releases acetylcholine, but acetylcholine fails to bind to its receptor. So it results in the absence of end plate potential and lack of muscle contraction. Then curare. Curare is a plant product used as a South American arrowhead poison for hunting. The animal hit by such arrow suffers from the paralysis in all the skeletal muscles including the respiratory muscles, and the animal dies of asphyxiation. Then galamine. Galamine is given before surgery to relax the skeletal muscles. It reduces the required dose of the general anesthetic as well as bleeding and other complications. As the respiratory muscles are also relaxed, the patients are supported with the artificial ventilation. Depolarizing blockers. Drugs like succinylcholine and carbamylcholine have the biological activity of acetylcholine, but they are not hydrolyzed by acetylcholine esterase. Therefore, their action is long-lasting. When they bind to acetylcholine receptor, the ion channel remain open in the end plate. And the maintained depolarization keeps the voltage-gated sodium channel in an inactivated state and blocks the action potential. There are other drugs that produce the blockage by inactivating acetylcholine esterase reversibly or irreversibly. So reversible acetylcholine esterase inhibitor. These agents compete with the acetylcholine to bind to acetylcholine esterase, thereby prevent the hydrolysis of the acetylcholine by the acetylcholine esterase. The accumulated acetylcholine at the synaptic cleft bind to the receptor, and that leads to a depolarizing block. This is of use in disease like myasthenia gravis, where the excess acetylcholine is requirement in face of decreased acetylcholine receptor. Neostigmine and physostigmine, that are an example of the reversible acetylcholine esterase inhibitor. Their attachment with the acetylcholine esterase decreases when the concentration of the drug falls, so the block is removed after some time. And this block can be overcome by application of curare that attaches to the acetylcholine receptor and reduces the effect of excess acetylcholine on the end plate membrane. Then irreversible acetylcholine esterase inhibitor. The organophosphorus compound, pesticides like parathion, malathion and begone. And the now gases used in chemical warfare like diisopropyl furophosphate and serine bind to acetylcholine esterase very tightly. This binding is irreversible. The lack of the hydrolysis of the acetylcholine produces sustained depolarization of the end plate, resulting in no further contraction in response to nerve stimulation. Poisoning with these agents lead to skeletal muscle paralysis and death from asphyxiation. Now gases also cause accumulation of the acetylcholine at the cardiac pacemaker cells. Therefore, in cases of the now gas exposure, atropine, that is a muscarinic receptor antagonist, that is given as a antidote. Now there are certain membrane toxins. The neurotoxins like tetrodotoxin, TTX, that is found in ovaries of the puffer fish and in tissues of salamanders, and saxitoxins, STX, is accumulated in the tissue of sailfish. Both are lethal paralytic toxins, and eating a small quantity of the tissue containing the toxin can lead to death. And these animals have survived by developing a resistance against the toxins, and they have a TTX resistance or STX resistance sodium channel. Sodium channel blockers. The drugs like lidocaine and procaine, and the neurotoxins like tetrodotoxin and saxitoxin block the voltage gated sodium channel and hinder the generation of the action potential. Thank you.